Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the pathophysiology of insulin. Insulin play a critical role in balancing the glucose level in the body. It can inhibit the breakdown of glycogen or the process of the gluconeogenesis. It can stimulate the transport of glucose into fat and muscle cells. It can stimulate the storage of glucose in the form of glycogen. Next, insulin is released into the blood by the beta cells found in the islets of Langerhans in the pancreas, in response to rising the level of blood glucose, typically after eating. Lower the glucose level result in decreased insulin release and from the beta cells and result in breakdown of glycogen to glucose. This process is mainly controlled by the hormone glucagon and which act in the opposite manner to insulin. If the amount of insulin available in us insufficient, if cell respond poorly to effect of the insulin, if insulin the itself is defective, then glucose will not absorb properly by the body cells and the net effect is persistently high level of glucose, poor protein synthesis and breakdown of the fat storage, acidosis. When the glucose concentration in the blood remains high over time, the kidney will reach a threshold of reabsorption glycosuria. This increases the osmotic pressure of urine, polyuria, and increase the fluid loss. Lost blood volume will be replaced osmotically from the water held in body, cell, and the other body compartments, dehydration, and polydipsia. Next is the type 1 diabetes. Type 1 diabetes mellitus is characterized by loss of the insulin producing the beta cells of islet of Langerhans and in the pancreas leading to increase the two deficiency of insulin. The pancreas, common bile duct, endocrine tissues. There are two types of tissues, endocrine tissues and exocrine tissue and pancreatic duct, intestine, the islet alpha cells, beta cells and the gamma cells are in blue color and beta cells are in the red color and also there are alpha cells in green color. The beta cells are the glucose, insulin and the type that can be further classified as the immune mediated or the idiopathic. The majority of type 1 diabetes is of the immune mediated nature in which the T cells mediated autoimmune attack lead to the loss of beta cells and thus insulin. Most affected people are otherwise healthy and of the healthy weight. When onset occur, sensitivity and responsiveness to insulin are usually normal, especially in the early stages. Type 1 diabetes can affect children or adults, but was traditionally termed the juvenile diabetes because a majority of these diabetes cases were in children. In today's class, I discuss about the type 1 diabetes and also about the pathophysiology of insulin. Thank you for watching.